on a slight jump in cases over the last few months. The state COVID dashboard shows a positivity rate of 15.6% as of August 13th. That's up from a 5.6% positivity rate on July the 12th. So this morning we're joined by Dr. Erica Pan from the California Department of Health to talk a little bit more about the increase people are seeing. Would you consider that a significant increase, or is it what you would expect this time of year just with illnesses in general?
Yes, that's a great question. I think we have typically seen a big summer increase and then a big winter increase. So this year, we didn't see anything in July, but just in the last few weeks, as mentioned, we've seen some increases in test positivity and more recently as well, maybe a slight increase in hospitalization. But thankfully, overall hospitalizations for COVID remain very low and similar to the lowest levels we've had over the last 3 years of this, of having SARS.
Which is tremendous news and something to not lose sight of, considering where we were just a couple of years ago. One thing I have heard anecdotally from people who've had this new variant that's out there, some people call it the Eris variant, is some people who have had COVID before have said this one really hit them kind of hard for 24 hours. Is that a common experience?
I think in general, this virus is still, one to take seriously. And there hasn't been anything, published around the newer variant that's circulating and whether it truly has any real clinical differences. But I think, everyone who's had a case of COVID has a spectrum, just like with flu. Mm-hmm. Sometimes it hits you really hard and sometimes it doesn't, but it's still a very serious infection. Of course, we still have concerns about the potential long-term effects of a COVID infection as well.
So as we look ahead to the fall, we're probably within a month or so of starting to get the push to get things like a flu shot, to get COVID boosters. What do we know about COVID boosters heading into the fall and the flu as well, while we have you?
Sure. Yeah, I think a couple things to mention because you asked about this newer variant. It's important to know that this variant that seems to be increasing now, which consistently happens with this virus, it is still kind of a grandchild or sub-variant of the Omicron and definitely related to the element that will be in the new vaccine that we expect by the end of September.
Okay.
So we encourage everyone to get up to date on vaccines when that new booster is available. Get your flu vaccine in time. And we're really excited that this year there is more RSV vaccine available as well for both people over 60, and one way to protect young infants is coming very soon as well.
It's not great to find out you have COVID. I guess a good reminder to people that you still do have to take it seriously, not unlike when you have another illness, and protect the people around you.
That's right, especially those who are at high risk. So again, the elderly, people who have immune systems problems, pregnant women really need to be very careful about all of these viruses as well. Can really hit pregnant women hard and or impact their pregnancies. And then infants again as well. Their immune systems are not as developed and they're too young to be vaccinated sometimes. So it's really important for all of us to do what we can to prevent infecting those who are most vulnerable.
All right, Dr. Pan, thank you for joining us today. We appreciate it.
Sure, thank you for having me. Take care.